So, the next question is question number 121. Answer is A. This is regarding rhabdomyolysis, that is, it can be caused by trauma, prolonged immobilization, burns or crush injury. There are certain cardinal features which we should remember in rhabdomyolysis, that is, increase in creatinine, increase in SGOT, increase in LDH, right, decrease in calcium, increase in uric acid, increase in potassium. So, just remember that there is hypocalcemia and rest all the things will be increasing in rhabdomyolysis. Question number 122. The answer is A, interstitial nephritis. Interstitial nephritis. Again, it can be of two types, acute or chronic. Most commonly, the interstitial nephritis is caused by drugs, and there is eosinophiliuria. All right. Next question is question number 123. Answer is A, that is E. coli. HUS is caused by E. coli. It is a characteristic of E. coli infection caused, and the manifestation is microangiopathic hemolytic anemia, that is MAHA. Microangiopathic hemolytic anemia, thrombocytopenia, fever, red cell fragmentation, that is schistocytes. All right. So, there is decreased platelet count, there is formation of schistocytes. Question number 124. Answer is decreased urinary citrate. It is classical of renal tubular acidosis. Answer is C. Remember, renal tubular acidosis should be remembered by heart. It is a very important topic, particularly for MCQs. One of the other exam around the country will have MCQs from renal tubular acidosis. So, try to remember this by heart, right. In the booklet where you have explanations for the questions, RTA has been explained very well. Question number 125. Answer is B, that is type 2. All right, it is again related to renal tubular acidosis. Question number 126. The answer is B. The table has beautifully shown that it is only Gordon syndrome where you have increased potassium, right, along with acidosis. So, remember, out of Barter, Gittleman, Gordon and Liddle syndrome, only Gordon syndrome will have increased potassium and acidosis. Similarly, Liddell's and Gordon will have hypertension and the aldosterone levels will be low, decrease aldosterone. Question number 127. This question we covered in SWT part 1, all right, autosomal dominant polycystic kidney disease, and the lungs are spared in this type of disease. It is hepatic cyst which is the most common. So, answer is A. 128. See, dyslipidemia is an essential feature of hypothyroidism. So, you treat hypothyroidism, dyslipidemia is treated. So, in this patient the answer is D. Question number 129. Answer is B, aplastic anemia. Question number 130. Answer is D. You do not do bone marrow transplantation for hemochromatosis. The treatment of choice is removal of excess iron by chelation, and obviously you require supportive treatment. Say for example, if they have cardiac failure, you treat cardiac failure. They have diabetes, you treat diabetes. You have hypogonadism, you treat hypogonadism. Question number 131. 131. The answer is all of the above. Liver disease, thalassemia, post-splenectomy, hemoglobin C. These cause target cells. Target cell is that central area of hemoglobinization. Usually we have central pallor, it is opposite of central pallor. So, answer is D. Question number 132. Answer is A. That is liver damage. Anemia of chronic disease usually have normocytic, normochromic appearance. Serum ferritin is increased as a marker of inflammation. Serum iron is usually normal or it would be low. TIBC is usually normal and maybe sometimes low. Question number 133. See, this infusion of acid will produce heartburn only in patient who have GERD. So, the answer is C. It is a simple question. 134. I am sorry. For 133, the treatment of malignant pheochromocytoma, Averbuch's chemotherapy protocol, remember it is for malignant pheochromocytoma. The answer is B. Question number 134. The answer is C, GERD. Question number 135. Lisker sign when you percuss anteriorly on the shin, patient has pain. So, it is a sign of DVT. So, answer is A. Question number 136. Renal biopsy, it is a true cut needle which is used, right. Bone marrow biopsy is by Trefenil needle or Jamshedi needle. You should remember contraindications if you have a small single functioning kidney, if you have polycystic kidneys, or there is severe renal artery stenosis, there is bleeding tendency, there is refractory uncontrolled hypertension, all right. So, answer is A, true cut needle. 137. Vitamin D resistant rickets, the answer is A, hypophosphatemia. We have already discussed hypophosphatemia in SWT 1. UK PDS trial is a landmark trial in type 2 diabetes. It is a landmark trial, remember it. So, it is answer is B. Question number 139. Classification of CKD, one has to remember it by heart. Anything less than 15 is stage 5, 15 to 29 is stage 4, 30 to 59 stage 3, 60 to 89 stage 2, anything above 90 is stage 1. So, answer is C. Question number 140, answer is B, it is X-linked recessive. X-linked recessive, and it is deficiency of factor 5 is X-linked recessive. Answer is B. One 1-alpha hydroxylase deficiency. See, progesterone is converted into 17 hydroxyprogesterone, 17 hydroxyprogesterone with 1-alpha hydroxylase. All right. See, if it is absent, this progesterone will be converted into desoxycorticosterone, which is a type of mineralocorticoid. All right. So, it causes hypertension. So, answer is A. Question number 142. Pentasaccharide, answer is B, factor 10A inhibition. Mechanism of action is factor 10A inhibition. So, answer is B. 143. These are newer drugs actually. These are newer drugs, rivaroxaban, apixaban, these are factor 10A, novel factor 10A inhibitors. See, the symptoms described in question number 143 are classical of celiac disease. So, the celiac disease diagnosis is by anti-endomysial antibodies. Answer is D. 144. See, King's criteria, it uses prothrombin time and it is a marker of acute liver failure. So, answer is C. Question number 145. The drug is actinomycin D, you have to remember is as such. Answer is C. Question number 146. Isolated PTT prolongation, it reflects intrinsic pathway defect. So, either there is factor 12 deficiency or there is hemophilia A. So, the answer is factor 12 deficiency, because there is no bleeding during the surgery, right. So, and isolated PTT prolongation. So, answer is C. 147. Tumor lysis syndrome, just like I explained in earlier question, hypercalcemia is the answer. Answer is B. Jail fever is rickettsia provaziki. Remember, jail fever. Answer is A. 149. Again, the answer is A. The latent period for when PSGN is associated with cutaneous rather than pharyngeal infection. There are two types of infection which can occur with streptococcal disease, pharyngeal disease and cutaneous disease. Both are associated with development of post streptococcal glomerulonephritis, but the latent period is longer with cutaneous as compared to throat infection. So, answer is A. Question number 150. Answer is C. TNF alpha. You can remember TNF alpha is a stress response system, and in stress you have insulin resistance, and when you have insulin resistance you have obesity. So, TNF alpha is the answer. (151). It is a drug for carcinoid syndrome, new drug, and it is 5-HT3 receptor antagonist. So, answer is C. You have to remember it as such. 152. Pegvisomant is a drug used in acromegaly. It is a growth hormone receptor antagonist. So, the answer is C. Question number 153. HJ body occurs in post splenectomy. So, answer is A. 154. Anemia will cause hyperdynamic circulation. And hyperdynamic circulation cause systolic murmur. You may have fatigue, you may have pallor, you may have edema, but you won't have diastolic murmur, you will have systolic murmur. So, the answer is D. Question number 154, sorry 155. Bacterial overgrowth syndrome. So, the cause is vitamin B12 deficiency. All right. So, answer is B. What happens in a blind loop? You have an intestine, right, like this. Because of something, the proximal part of the intestine is connected to the distal part. So, the passage of food is here to here, this way. This is the blind loop. This is the blind loop, and it acts as a reservoir for bacteria. So, bacterial overgrowth occurs and there is lack of vitamin B12. Question number 156. Again this question is a repeat question from SWT 1. We have already discussed this there. The answer is B, thymine. Question number 157. Answer is A. You won't find splenomegaly in aplastic anemia. That is very obvious. Answer is A. 158. Fanconi's anemia is autosomal recessive. So, the answer is A. 159. We have already discussed it, anemia of chronic disease. I told that serum ferritin increases, serum iron decreases, may be normal, total iron binding capacity may be normal or it decreases. So, the answer is A. Question number 160. Transferrin saturation is serum iron by TIBC into 100. Simple. You can, this helps in differentiating hemochromatosis or other iron overload states from various anemia of chronic disease, say for example cirrhosis. Cirrhosis liver, you may have anemia, but the serum ferritin will be raised because of increased inflammation. So, it is difficult to ascertain whether there is iron overload causing cirrhosis or it is because of the inflammation you have a raised ferritin level. So, answer is A. One 61. Question number 161, answer is D. Very well explained in the explanation book regarding sideroblastic anemia. Question number 162. Autoimmune hemolytic anemia as per the ACR criteria is one of the diagnostic criteria for SLE. Remember, Coombs positive autoimmune hemolytic anemia. So, the answer is SLE. C. Question number 163. Spur cell anemia. Yesterday I discussed in a question difference between Burr cell and spur cell. This is echinocyte, this is acanthocyte. This is smooth with central pallor, this is sharp with no central pallor. So, question number 163, answer is A, spur cell found in alcoholic liver disease. Question number 164, hereditary spherocytosis, MCV is less, it is not more, they are spherocytes, right. The answer is C, 165. You know, in PNH, there is a grave risk of cortical cerebral venous thrombosis. Remember, life-threatening complications of PNH. So, answer is A, venous thrombosis. Question number 166. In sickle cell disease, you do not have splenomegaly because of autosplenectomy. And definitely bone pains are common. So, the answer for this question is B. Question number 167. Beta thalassemia, the mutation is intron 1, you have to remember it as such, intron 1. Question number 168. Answer is B. The syndrome, the answer is B. It is relative erythrocytosis. Relative erythrocytosis. So, answer is B. You correct the cause, that is erythrocytosis reverse. Question number 169, cerebellar hemangioblastoma is the most common associated tumor in this. So, answer is C. Question number 170, raised HbF, the cause is juvenile CML, alright. The other causes are very well written in the explanatory book, that is thalassemia, sickle cell anemia, HbFF. The answer is A. Question number 171. The answer is D, spontaneous bleeding. It does not happen in polycythemia vera. Question number 172. Answer is again D, hairy cell leukemia. You know, the best test for hairy cell initial test is PBF for hairy cell leukemia. You have classical hairs which are present there. Russell body, question number 173 occurs in plasma cells. So, answer is D. These are the questions which one has to remember as such. There are no explanations for these questions. The investigations of multiple myeloma. See, beta 2 microglobulin, remember beta 2 microglobulin is for prognosis. On X-rays, you have punched out lesions, punched out lesion. ESR, one of the conditions where ESR is very high, would be more than 100. All right. So, the answer is Bone scan does not find a role in diagnosis of multiple myeloma. Plasma cells on bone marrow aspiration more than 10%. So, the answer for this is C, bone scan. Question number 175. Again the same thing, increased ESR in multiple myeloma, answer is C. Question number 176. Answer is C, paraneoplastic cerebellar degeneration. This is associated with paraneoplastic cerebellar degeneration. Answer is C. 177. Answer is D, Burkitt's lymphoma. Question number 178. It's an important question. Question number 178. Prognosis of ALL. You know, monosomy, it carries worse prognosis, whereas translocation T821, which we normally read, carries good prognosis. It is monosomy 7. Answer is D. 179. Effects of aspirin. See, aspirin acts on platelets, and platelets are responsible for control of bleeding. So, it is the bleeding time which will be prolonged, not clotting time. So, answer is A. Question number 180. Answer is C, bleeding time will increase and clotting time will be normal. Obviously, clotting time does not depend upon platelets, bleeding time depends upon platelets. So, answer is C. Question number 181. ITP is also very important from clinical viewpoint and as well as for examination viewpoint. Answer is C, it is an autosomal dominant disease, remember is as such. Question number 182. See, it is a 1% reduction in the clotting factor which results in the clinical manifestation. So, answer is A, 1%. Question number 183. It is decreased coagulation factor levels. Answer is C. Remember heparin in toto, all the side effects of heparin. Heparin induced thrombocytopenia known as HIT, bleeding, right, in prolonged administration, osteoporosis. So, these are side effects of heparin. Heparin is an important drug to remember, all right. So, answer is all of the above, answer is D. Question number 185. Again the answer is direct thrombin inhibitor, answer is D, all of the. These are newer anticoagulant, novel anticoagulants, and we have to remember them all by heart. Answer is D. Novel anticoagulants, it is known as NOVAC, novel anticoagulants, NOVAC. Question number 186. Hypokalemia is caused by vitamin B12 therapy, remember it. So, the answer is B. The plausible explanation of vitamin B12 giving rise to hypokalemia lies in the fact that if RBCs are destroyed, it gives rise to increased potassium. Vitamin B12 will cause increased RBC formation, thereby consumption of potassium leading to decreased potassium levels. Right. So, question number 187, cerebral salt wasting syndrome. So, answer is D. 188. See, the HCO3 is 38. So, it is alkalosis. Which alkalosis? Obviously, metabolic. And PCO2 is 20. PCO2 is 20. Again, it is respiratory alkalosis. So, it is a mixed disorder, metabolic as well as respiratory alkalosis. So, answer is D. You will commonly find questions from ABG, anion gap, interpretation of ABGs. So, please remember ABG by heart. It is very simple anion gap calculation. Sodium is 135 minus you have chloride is 104 and your soda bicarb is bicarbonate is 10. So, the answer is 21. ABG, sorry, anion gap answer is 21. Answer is A. Question number 190. See, the classical or the gold standard, I am not talking about screening test, but the gold standard test for Cushing's disease is you test for the hormone levels from inferior petrosal sinus venous sampling, right. So, answer is D. It is not suppression test, it is the absolute hormone which you measure when you talk about gold standard tests. However, screening tests are different. You can do various this low dose dexamethasone suppression test, you can have urinary free cortisol levels, etc. Question number 191, FITTER. FITTER is some injection technique and a panel for injection technique. So, they recommended that 4 mm size needle is required in the pen for management of diabetes and 6 millimeter size is required for syringes, right. So, the answer is A. Question number 192. Answer is C. It is very obvious, we have already discussed this in SWT1. Calcium is raised and phosphate is reduced. Answer is C. Question number 193, hypermagnesemia. Remember, increased magnesium levels, bradycardia and hypotension. Usually you have tachycardia with hypotension, but here it is bradycardia and this is refractory to conventional treatment. Refractory to treatment. So, answer of 193 question is B. Question number 194. Spinal shock, very similar, in fact exactly similar to hypomagnesemia. Answer is hypotension with bradycardia. Answer is A. Question number 195. The best treatment to control hemolysis is in PNH is prednisolone. It is prednisolone. So, answer is D. Question number 196. Sorry, I am so sorry. Question number 195 is regarding ACTH stimulation test. Answer remains D, but it is for ACTH Addison's disease. The most confirmatory test for Addison's disease is ACTH stimulation test. Question number 196 was for PNH. In PNH, to control hemolysis, the drug of choice is prednisolone. Question number 197. Isothenuria. Isothenuria is passage of urine which has the same osmolality as that of serum. Isothenuria. Sorry. It is found in sickle cell disease. Answer is D. Question number 198. For thalassemia, if you want to confirm thalassemia, it is a genetical disease. So, obviously, you go for DNA analysis. So, answer is D. Question number 199. Adipsic hypernatremia means a person is not drinking, and that is causing hypernatremia. So, you give hypotonic solutions if the patient is unable to drink free water. So, the answer is 5% dextrose. The answer is A. Question number 200, that is the last question. This is a feature of Wilson's disease, KF ring, which is shown in the cornea. Answer is B. We have already discussed Wilson's disease. Thank you.